Many people today have heart problems without realizing it. The heart reacts sensitively to stress, poor nutrition, lack of exercise, and age. Before you can understand why symptoms appear, you need to know what the heart actually does. It is a muscle, about the size of a fist, located slightly to the left behind the breastbone. Its task is simple: it pumps blood through the entire body. With every beat, it delivers oxygen and nutrients to all organs and returns used blood to the lungs. A healthy heart beats around 60 to 80 times per minute, adding up to more than 100,000 beats a day. Without pause. Without interruption. When the heart becomes weaker, people often notice it very late, which is why understanding this organ is so important. To understand heart problems, you need to know how the circulatory system functions. The heart works in two connected systems: the systemic circulation and the pulmonary circulation. In the systemic circulation, the heart pumps oxygen-rich blood to all organs. There, the oxygen is used, and the blood returns low in oxygen. In the pulmonary circulation, this blood is reoxygenated in the lungs. This cycle repeats constantly, beat after beat. The right side of the heart receives the used blood, and the left side pumps the refreshed blood back out. This rhythm keeps the entire body alive. When the circulation becomes strained, early signs often appear: a faster pulse, fatigue, or reduced endurance. These are early indicators that the heart is working harder than before. Many heart problems start quietly. The first signs are often so subtle that people mistake them for stress, fatigue, or harmless discomfort. Typical situations include sudden physical effort, climbing stairs, walking faster, swimming, or running. Some people then feel unusually rapid heartbeat, shortness of breath, or the sensation of not getting enough air. Others notice a pressure in the chest that is not necessarily painful but feels unusual. These early warning signs are often ignored because they do not occur constantly. Yet these brief moments show that the heart is reaching its limits under stress. Even mild heart attacks can go unnoticed, appearing only as brief chest pressure, nausea, or extreme tiredness. Anyone who notices such changes should take them seriously and have them checked by a healthcare professional. Early evaluation makes a big difference. A heart attack usually occurs when the blood supply to the heart muscle is suddenly blocked. The most common cause is narrowed or calcified coronary arteries. These vessels supply the heart with oxygen. When they become tighter due to plaque buildup, the heart receives less blood. During physical effort, this reduced supply may no longer be sufficient. If inflammation, a blood clot, or a sudden rise in blood pressure occurs on top of this, a vessel can close completely. At that moment, a heart attack begins. People with heart failure, high blood pressure, diabetes, excess weight, or long-term arterial calcification have a higher risk because their heart is already working under strain. Stress, intense physical effort, or sudden exertion can also overload a weakened heart. A heart attack does not always start with severe chest pain. Sometimes it appears as shortness of breath, pressure in the chest, nausea, or extreme fatigue. Any of these changes should be taken seriously and evaluated by a healthcare professional. People with heart conditions often take several medications at the same time: blood pressure drugs, beta blockers, cholesterol-lowering agents, or medications for rhythm disorders. Each of these has a specific purpose. But not all combinations work smoothly together. Some substances can lower blood pressure too much, slow the heart rate excessively, or make the cardiovascular system more sensitive. In rare cases, a medication can even trigger symptoms that resemble a heart attack or increase the risk if the arteries are already narrowed. This is why it is essential that all medications are coordinated and regularly reviewed. New symptoms after a medication change should never be ignored. They may indicate that the body is reacting differently than expected. Only a medical evaluation can determine whether the combination needs adjustment. The development of a new medication used to be an extremely long process. Between the first idea and final approval, 10 years or more often passed. The reason was the enormous amount of work required, identifying potential substances, testing them in the laboratory, evaluating them in animal studies, and then conducting several clinical trials in humans. Each phase took years to ensure that the medication was effective and safe. Many substances failed along the way because they did not work well enough or showed unexpected risks. Today, artificial intelligence is changing this process. AI can analyze millions of data points in a short time, predict promising drug candidates, and detect potential risks early. This makes several steps faster and more precise. Safety standards remain the same, but the path to a finished medication becomes shorter. What once took years can now be prepared in months. Heart medicine has advanced significantly in recent decades. Many procedures that once required major surgery can now be performed minimally invasively. Narrowed coronary arteries can be widened with a catheter, and a stent keeps the vessel open. In more severe cases, a bypass can redirect blood around the blockage. Heart valves that no longer function properly can be repaired or replaced, often without open heart surgery. For people with rhythm disorders, modern pacemakers help maintain a stable heartbeat. In cases of severe heart failure, mechanical pumps can support the heart by taking over part of its workload. In rare situations, a complete artificial heart is used to maintain circulation. These developments show how far modern medicine has come. Many conditions that were once life-threatening can now be treated or stabilized effectively. Thank you for taking the time to watch this film until the end. Understanding the heart can change lives, sometimes even save them. If this information was helpful, feel free to subscribe to the channel. It supports our work and ensures you automatically receive the next videos in this health series. Take care of yourself and stay healthy.